Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why do I have white spots on my tongue? White spots on the tongue usually are not serious and can have causes that range from poor oral hygiene to overgrowth of microbes. In rare cases, white patches in the mouth or on the tongue can be a sign of a more serious condition. /r/n/r/n If you have white patches or spots in your mouth that are painful or don't resolve within a few weeks, it is important to contact a healthcare professional and receive proper treatment if needed. /r/n/r/n This article looks at some of the conditions that can cause white spots or patches to appear on the tongue or elsewhere in the mouth. It also discusses how these conditions are treated. /r/n/r/n Barraud Getty Imagesrnrn In general, a white tongue or white patches on the tongue are caused by poor oral hygiene. This discoloration can extend over the entire surface of the tongue or appear as patches in certain areas. Some people might notice redness, bad breath, or a bad taste in the mouth. /r/n/r/n A normal tongue is covered with tiny bumps called papillae. Papillae contain taste buds and help you sense temperature and touch. They are usually pink or white. /r/n/r/n When you don't brush and floss regularly, bacteria and yeast can build up on your tongue. This white buildup causes the papillae to become inflamed and discolored. /r/n/r/n An ADAapproved mouthwash and/or a tongue scraper can help remove the buildup, and regular brushing and flossing can prevent its recurrence. /r/n/r/n White tongue can show up suddenly if there is an infection or irritation, or it can build up over some time. Besides poor oral hygiene, other causes of a white tongue include /r/n/r/n Sometimes, white spots or patches on the tongue are caused by health conditions, some of which require treatment from a healthcare provider. /r/n/r/n Canker sores are small ulcers that can appear on the inside of the lips, the cheeks, or the tongue. They can look like white or yellow spots with a red border. They are also called aphthous ulcers. /r/n/r/n Canker sores are common, affecting up to 20% of the population. Their exact cause is unknown, but they are believed to be related to varying factors such as vitamin deficiency, trauma, such as biting your cheek, infection, or food sensitivity. They may also have genetic causes. /r/n/r/n Canker sores usually go away on their own in 1 or 2 weeks. You can apply a gel or cream such as Orajel or Anbesol, benzocaine topical, to the sore to limit the pain and speed healing. /r/n/r/n If you have recurrent canker sores, your healthcare provider can prescribe medicated mouthwash to help prevent outbreaks. /r/n/r/n Transient lingual papillitis is a condition commonly known as lye bumps. Lye bumps are inflamed papillae. They usually appear suddenly and can be white or red in appearance. /r/n/r/n Lye bumps can be painful and itchy. They may also cause a burning or tingling sensation and sensitivity to hot food or drink. You may even experience discomfort while eating. /r/n/r/n Lye bumps are more common on the tip of the tongue or along the sides. /r/n/r/n The cause of lye bumps isn't well understood, but they are thought to be related to trauma, such as biting your tongue or wearing braces. They may also be related to stress, poor nutrition or sleep, eating spicy foods, smoking, or burning your tongue. /r/n/r/n Lye bumps usually go away on their own in a few days. In severe cases, they can last up to 3 weeks. If you are experiencing pain, your healthcare provider may recommend corticosteroids, medicated mouthwashes and rinses, and avoiding hot foods. /r/n/r/n Oral thrush is a fungal infection in the mouth that is usually located in the lining of the mouth and tongue. The cause of thrush is an overgrowth of a yeast called Candida. /r/n/r/n. This growth has raised white lesions on the inner cheeks and tongue and can cause /r/n/r/n. Thrush is usually diagnosed on physical exam and rarely requires taking a throat culture. It's important to check with a healthcare provider to get the proper diagnosis and treatment. /r/n/r/n. The typical treatment for oral thrush is a prescription of antifungal medication. This can come in the form of lozenges, tablets, or liquid. This treatment is usually prescribed for 7 to 14 days. /r/n/r/n. Treatment also depends on /r/n/r/n. Your healthcare provider can give you the proper treatment and also rule out if there are other medical conditions that are a result of what is presented. /r/n/r/n. Leukoplakia happens when one or more lesions or white patches form inside the mouth. This condition is known to develop into oral cancer in a certain percentage of people. /r/n/r/n. The two types of leukoplakia include /r/n/r/n. Tobacco use and heavy alcohol consumption are risk factors for leukoplakia, though people without these risk factors can also develop the condition. /r/n/r/n. Diagnosis is usually made from a biopsy. /r/n/r/n. It is important to speak with a healthcare professional to get a proper diagnosis, treatment, and plan that will give you the best outcome. /r/n/r/n. When treating leukoplakia, the goal is to prevent cancer. Although the lesions can be removed, they can also return. If you smoke and drink alcohol regularly, it is important to stop. /r/n/r/n. Treatments include /r/n/r/n. Another option is surgery to remove the lesions. Although a patient may opt for surgery, there is around a 30% chance that the lesions could return. /r/n/r/n. Hairy leukoplakia describes white patches that appear along the outside borders of the tongue. These patches don't rub off and may look hairy. /r/n/r/n. Hairy leukoplakia almost always appears in people with severely weakened immune systems, such as those with an HIV infection. It is caused by the Epstein-Barr virus, which commonly causes infectious mononucleosis. /r/n/r/n. Hairy leukoplakia is often diagnosed based on medical history combined with a simple oral exam. If your healthcare provider thinks there's a possibility the patches may be caused by another condition, they may also do a biopsy. /r/n/r/n. Hairy leukoplakia does not usually require treatment, though the condition that is causing your weakened immune system may need to be managed differently. If you have HIV, for example, your healthcare provider may want to change your treatment plan to help strengthen your immune system. /r/n/r/n. Some cases of hairy leukoplakia may require treatment with a topical medication. If the sore is causing severe symptoms, they may recommend having it surgically removed. /r/n/r/n. Cold sores caused by the herpes simplex virus, HSV, can sometimes appear on the tongue. These may start out as areas of redness, swelling and pain. As the sores develop, they may look like a white patch or spot that turns into a yellowish ulcer. The sores may also appear on other parts of your mouth or on your throat. Cold sores typically last for 1 to 3 weeks. /r/n/r/n. Cold sores on the tongue are usually diagnosed with an oral examination. Your healthcare provider may also take a sample of the fluid inside the sore. The sample will be sent to a laboratory, which can confirm its cause. A blood test can also help identify an aphthous infection. /r/n/r/n. There is no cure for the herpes simplex virus, but treatment may include /r/n/r/n. Geographic tongue is an inflammatory condition of the tongue. It causes a bald, red area with an irregular white border to appear on the top or sides of the tongue. Most people have no other symptoms, though some may experience a burning sensation on the tongue. /r/n/r/n. Geographic tongue is caused by the loss of papillae, though it is unclear why this occurs. Some possible causes include stress, hormonal problems, or chronic conditions like allergies or diabetes. The condition may resolve on its own or it may come and go. /r/n/r/n Geographic tongue is usually diagnosed based on your symptoms and the appearance of your tongue. /r/n/r/n Since geographic tongue doesn't usually cause pain or other uncomfortable symptoms, treatment isn't usually necessary. If you do have discomfort, your healthcare provider may recommend a topical anesthetic or an anti-inflammatory medication to help control pain. /r/n/r/n Syphilis is a sexually transmitted infection that can occur and spread through sexual contact with someone who has the condition. If the infection is left untreated, syphilis can lead to serious health issues, including /r/n/r/n This condition also includes white on the tongue. The symptoms are dependent on the stages. Syphilis in the mouth typically starts as a small, painless sore that may be yellow in color. The first sore can appear on the lips or on the top or side of the tongue. /r/n/r/n As the disease progresses, you may develop multiple mucus patches in your mouth, which can be oval or have a wavy border. They may be silvery or white. /r/n/r/n During the second stage of the disease, a bumpy rash may appear on the body, typically the hands or soles of the feet or palms. Other symptoms include flu-like ones such as muscle aches, fever, sore throat, or fatigue. /r/n/r/n It is important to speak with a healthcare professional to get the proper treatment and education regarding the infection. /r/n/r/n Syphilis is typically treated with antibiotics. Your healthcare provider will test your blood after the entire course of treatment is complete. It is important to get tested regularly and to practice safer sex, including the use of condoms. /r/n/r/n Oral lichen planus is a condition that appears in the mouth. It stems from lichen planus, a chronic disease that affects the mucous membranes and skin. This happens when mucus is secreted from the thin layers of tissue that line the body cavity. It is not contagious and usually affects people who are more than 50 years old. /r/n/r/n Symptoms include white patches on the inside of the cheeks that are slightly raised or the look of web-like threads. If it is excessive, the gums are bright red. If it is severe, ulcers tend to develop on the gums of the mucosal tissue. /r/n/r/n There is no definite known cause of this condition, although research suggests that genetics and the immune system play a part. Some medications and diseases can also cause oral lichen. These include nonsteroidal anti-inflammatory drugs and beta blockers. The diseases include primary biliary cholangitis, formerly known as primary biliary cirrhosis, and hepatitis B. /r/n/r/n Certain medications such as antibiotics and muscle relaxers are known to cause white patches. Antibiotics create yeast, which can lead to the occurrence of white patches in the mouth. /r/n/r/n If oral lichen planus is mild, it may go away on its own over time. A healthcare professional will monitor the condition, and treatment may not be needed. In the event that the symptoms worsen, the doctor may recommend treatments. Some of the medications used to treat oral lichen planus include /r/n/r/n Oral cancer can affect the tongue as well as other parts of the mouth. It may appear as a white or red patch. There are usually additional symptoms, such as /r/n/r/n Anyone can develop oral cancer, but you are more at risk if you smoke, are a regular alcohol user, or if you have a human papillomavirus (HPV) infection. Additional risk factors include /r/n/r/n Your dentist or dental hygienist will examine your mouth for signs of oral cancer during your regular dental checkup. If they find any suspicious lesions, they will refer you to a specialist for evaluation and treatment. /r/n/r/n Oral cancer is treatable if caught early. Depending on factors such as your health, the stage of cancer, and the location and size of the tumor, Treatment may include /r/n/r/n. You probably don't need to see a healthcare provider if a white tongue is your only symptom, unless the white patches are excessive, unusual, or persist for more than 2 weeks. However, you should make an appointment if you have a white tongue along with other symptoms such as /r/n/r/n. It is important to see a healthcare provider if you notice anything unusual in your mouth, especially a sore or spot in your mouth that doesn't resolve on its own. You should also do so if you have white patches on your mouth or tongue that don't go away after 3 weeks. /r/n/r/n. White spots or patches on the tongue usually have benign, not harmful, causes. You may get them when you are dehydrated or because of poor oral hygiene. Conditions like oral thrush and canker sores can also cause the appearance of white spots or patches in the mouth. /r/n/r/n. Some of these conditions resolve on their own, while others require treatment with antibiotics or medications such as antifungals. See your healthcare provider for mouth sores that are very painful, get in the way of eating or drinking, or don't resolve on their own in a few weeks. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.